Join பண்ணிட்டேன்.
தெரியல அவரு
Hello, Pooja. Hello.
Good afternoon, everyone. So we are right on time. It's 3 p.m. and it's the time for the user awareness session from BMJ. Today, we have this user awareness session on BMJ case reports and BMJ journals. And on behalf of Team BMJ, I'd like to welcome everyone. I'll request my colleague Shikhar Srivastava to welcome all of you.
Thank you. And first of all, on behalf of BMJ, I would like to welcome to the director, Professor Dr. B. Srinivas, the Director, National Medical Library, ADGME Medical Education at DGHS, Ministry of Health and Family Welfare, all the officials of National Medical Library, including KC Singh sir, and the member institutions under the National Medical Library and DGHS. At the very outset, BMJ would like to thank DGHS, the Ministry of Health and Family Welfare, and the Director National Medical Library for their vision and efforts to strengthen the Ermed Consortia, so that all the doctors, medical students, and healthcare professionals will get a seamless access of high impact factor journals and evidence-based resources, which will help to medical students and the healthcare professional to improve the healthcare outcomes in India. With this, I would like to invite respected Professor Dr. B. Srinivas, the Director, National Medical Library and ADGME at DGHS, to say a few valuable words about the Ermed. So I really welcome Dr. Srinivas.
Thank you, Shikhar. Good afternoon, all the members are now attending this valuable webinar. I first of all like to congratulate the organizers of this webinar that they have taken the efforts to see to it that all the participating institutions take full advantage of our Ermed. As you know, Ermed is a consortia which was made in 2016 onwards, and we're very proud that that Ermed has been in the forefront of disseminating valuable information across the country. And even this year, we have taken efforts to start, even though it was slightly late, but our Ermed has not in any way stopped in between the services that have been given all through this year. Now, Ermed plays a very important role in the digital library concept, because there are many institutions across the country, especially if you look at the district hospitals, they don't have valuable faculty, or they don't have valuable this digital library concept or journals which they're in the library. So in that way, Ermed can create for itself, and it creates a database. But all the colleges and even in remote area, they are able to access this digital library, and that is the main concept behind this digital library. In fact, our Honorable Minister and the Honorable Prime Minister was also of the view that now slowly and slowly, the whole library of NML should be made into digitalized concept, like digital library. So that in the future, we are planning that we will take in more journals, and I would also like to get the feedback from all the constituent librarians and the faculty who are there, that what are the various journals, how we can update it, how can we can update our more journals so that it becomes more informative in future. Also, we would like to have more learning materials also, and we are in the process of accessing or taking into more more journals for the future. There is also a plan to include all central government institutes under one platform. So maybe in future, AIMS and all AIMS like institutes will also be involved in the Ermed consortia. And definitely for that, the budget will increase, and we will try to get the best of the journals and to give it to the all our librarians and all our research people and faculty to make complete use of it. So with this, I would like to again congratulate our BMJ team and all the members, and I would ask Shikhar and their team to have the best material, and you should train the librarians and our faculty members that they can make use of this very well thought concept of Ermed, and everybody takes advantage of it, because knowledge is power, and we should see to it that nobody is deprived of knowledge, no matter where they're sitting and no matter whether it's a district hospital or a tertiary hospital. So thank you so much, and I wish all the organizing secretary and the organizing people all the best for the future, and all the members should be able to take help of this and upgrade the knowledge. Thank you so much. Thank you.
Thank you, sir. Thank you for your kind words and sharing your vision about that. Now we will start the session. So over to Pooja. Let's start to begin the session. Thank you.
Thank you, Shikhar, and thank you, sir, for your kind words. All right, everyone. My name is Pooja, and I manage customer engagement with BMJ. And today, I am here to take you through two very important resources that all of you through Ermed Consortium have now access to. The first one that we are today going to be discussing about BMJ case report. But before I do that, allow me to introduce all of you to British Medical Journal. BMJ is a global healthcare knowledge provider with a vision to create a healthier world. And we do that by sharing knowledge and expertise to improve patient outcomes. And how we do that is through our various resources. And those resources are BMJ journals. I would request my colleague Anand to move on to the next slide. And those resources are BMJ journals, BMJ case reports, BMJ learning research publication and best practice. But today I am going to be taking you through the first resource, which is BMJ case reports. So I'll just request my colleague to take you to the website of BMJ case reports. Anand. All right. So my apologies to everyone. Due to some technical issue, I'm unable to share my screen. So on my behalf, my colleague Anand will be taking you through the website. I will give you an overview about the resource and how you can have access to the resource and how you will be able to submit your case reports on this platform. So let's get started. So first of all, let me first inform all of you that all the institutions under an Ermed consortium from this year onwards have now got access to BMJ case reports. How you can access this report, this platform is through the institution's IP. You may also contact your library team for the user ID and password that has been shared with them in case if you want to register yourself and then use this particular resource. The information with regard to fellowship code has also been shared. Anand, could you please take us back to the website once again? Our apologies for the delay. So as it says on the website, the link for this website is casereports.bmj.com. And as it says, you're looking at one of the world's largest collection of clinical cases. On this platform, you would have access to cases of all specialities. And for this, all you need to do is just scroll through the page a little below, and you will find all those cases organized specialty wise. So based on your specialty, you can browse through these cases. And if you scroll further down, you will also see a tab which says view full list. View full list, yeah. So when you click here, you will also find the various types of other cases, because many a times there is a perception that is associated with case reports, and that is that we only publish rare cases. Case report is not about publishing the first rare case. We can never find the first rare case. So we are here to publish something that is completely focused on patients. The way you write a case should be written in a way that the doctor from any discipline should be able to understand, which means it need not be a rare case. It can be a case where there has been learning from errors. There can be myths where a myth has been exploded. So all those types of cases also can be found under the view full list tab here. Now we'll go back to the home page once again. And let me tell you that BMJ case report is also one of the most popular resources among doctors. The reason why? Because India is the third largest contributor when it comes to publishing case reports. So Anand, if you can just scroll the page a little above. And before you actually decide to publish a case report, I would request all the participants here, and even if there are librarians, I would always request them that always inform the doctors who want to publish a case report with BMJ that they should spend time with on the instruction for authors. The first tab that is here, instruction for authors. So I'll just click on this tab here, instruction for authors. And under this tab, there is immense amount of information that is available for an author, starting from what are the various types of cases that are templates that are available, and what is the editorial policy. Do we need a patient consent form or not, or what are the types of images that you can upload? So there is a lot of information that is required, and that is why we always emphasize on the fact that please spend time on the first tab. So for example, I'll take you through the first information, and that is how to write for BMJ case report. So when you click on that tab here, it will take you to the page where there are 3 types of templates that are now visible on the screen. The first one is a full case template. Second is the images or video-based template, and global health template. So if your case has a pandemic or a regional aspect, then global health template is the one that you need to refer to. And the approximate word limit for a global health template is approximately 5,000 words. To make it even more simpler for all of you to understand, let's say that in your city or in your state, there is a certain factory, and due to that factory, the people around that particular region are getting affected. It could be respiratory issues, it could be any other kind of infection. That becomes a global health template, a global health case for you. So this is the template that you need to refer to. Now let's say that if you have a case report where there is an image or a video that with which you would like to share some very important learning with the rest of the medical fraternity, then the second template is the one that you need to refer to, and the approximate word limit for this one is images or video is approximate 500 words. The rest of all the cases would come under full case template. And I'll just show you how a full case template would appear. It is a simple Word document. So Anand, if you can just share your screen for the full case template. So just to give you a brief idea about...
Yeah, just a minute, Pooja. Yeah, I am opening it.
Sure, thank you. So while my colleague is trying to open it, let me just give you a brief idea about the full case templates. These templates are basically Word documents. On the first page of this document, you will find a few checklist questions, which you will see in a couple of minutes. So as an author, it is a reminder. It is a reminder from our side to you that we want you to mentally tick these questions. For example, BMJ case reports only allows maximum of 4 authors. It also reminds you of that, are you using the right word template or not? No? And then further, there are further other questions about the editorial policy and such questions. So once you have mentally ticked all those questions, then you are ready to start with the template. So just give me a moment while the template is shown on screen. Anand, in the meantime, what we can do is probably we can just go to the patient consent form and we can come back to the template later. Yeah, okay. All right, so yeah, here we are on the BMJ case report template, full case template. So I was just talking about the checklist questions. So here are those checklist questions. So as an author, before you actually start penning down everything, there is a first instruction for you that have you read through the instructions? Are you using the right word template? Do you have the patient consent form? So we'll talk about patient consent form in a bit. So once you tick all these questions mentally, just go through all these, just scroll down the page further, and you will be able to see the rest of the questions. So there are probably 5 or 6 questions like this. So once you have ticked them, and then we start with the template. So Anand, if you can just scroll down further. Anand. So basically in this template, on the first thing that would appear is the title of the case. So the template would have headings such as the title, the summary, patient perspective. So it is designed as per the case report structure. So all you need to do is furnish all the information that is requested for. Here, okay, so I can see that Dr. Srijata Saha has raised her hand. Ma'am, please go ahead. You can unmute yourself and ask the question. Dr. Saha, you wanted to ask something? Okay, so we'll come back later to ma'am. Anand, I'm sorry, but
Yes, Pooja.
Can you please scroll down the page?
Yeah, I'm scrolling down. So right now it's showing the background, then case presentation.
Yeah, okay.
Yeah.
So can you just move on to a little further? Yeah, go to the title part first. Yeah.
Yeah.
Title. So as you can see, under each of these headings, there are tips given. And these are tips for the authors to actually note that what are the things that we expect them to write about when we talk about title of the case. For example, when we look at a title of the case, we want to look at something which is very clinical, very simple, and very boring titles. Why I said boring is because many a times the reasons a case report gets rejected is because the author would have tried to add humor to the title, or anything which is very mysterious or cryptic. The moment we see such titles, immediately such cases are rejected, on the go. Because and let me tell you that a lot of cases are rejected due to the titles as well. So we just want something very simple and very clinical. So that is what we have written here also. And as it says, do not include case report, because we know that this is a case report. This whole platform is all about case report. Similarly, coming to summary, the summary has to be about 150 words. The reason being, BMJ case report is indexed in PubMed and Scopus, and that is why we want the summary to be of 150 words. And if you scroll down further, you will see such tips for each of the heading. Anand, if you could just go back to my presentation, and I would just like to show you an example of a patient perspective. Could you please go back to my presentation?
Yes, Pooja. You can see the patient's perspective.
No, we can still see the template only, the Word document.
I have shared the screen, Pooja, and it's visible in my screen. The patient's
Okay.
perspective. Yeah.
No issues. Can you just go back to the website then?
Yeah, sure.
So just to talk about the patient's perspective, let me tell you that the patient's perspective has to be written in the patient's own words. And there would be scenarios where the patient may not be well versed with English. So in that case, it's absolutely fine. We would request the author to actually translate it in the exact words where the patient how the patient has said it. And when any doctor or any student reads through these patients' perspective, you should get the feel that it's patient talking to you directly. So that's how we expect it. And for that, I would recommend that before you actually start writing or working on a case report, just go through a few good examples. One of the ways, just go to any specialty and browse through the cases, and you can just look at few examples, which will give you a fair idea about it. Now, we'll talk about the second very important aspect, and that is about patient's perspective. So, Anand, can we go back to the last page, and we can just show where they can find the patient's perspective column?
Okay.
Yeah.
So you want patient perspective or patient consent? Which one?
Patient consent form, please.
Okay, fine.
So patient consent form, let me tell you all of you that we do not accept any case reports without the patient consent form. So it is always something that you would have to plan a bit ahead, that the moment you decide that this is a certain case that I would like to publish, then at the same time you would also have to think of getting the patient consent also. The patient consent form is available in various languages, and I think this is the network problem. It's taking some time to navigate from one page to another. But when you click on the patient consent tab there, you will see the scroll bar also, where you can find the options for the various languages of patient consent form. Now, I do understand that every institute would have their own patient consent form, but let me tell you that as an author, if you would like to publish with BMJ, then it is important that you need to have the BMJ's patient consent form. It's a very simple document, which it's a PDF form. It's just a 2-page document which basically asks for some very basic information, and you just need to furnish all that information. It should be filled in by the patient. In case of any language issues, it can also be done by the relative of the patient. And see, this is the example of one of the patient consent form. And there are various types of patient consent form also. Anand, if you can take me to the page where they can find the patient consent form.
Yeah.
If you can go to the website.
So
yeah, so this is where they can find the patient consent form. And there are various types of cases. Patient consent form, for example, there is a patient consent form for diseased patients who lack capacity, and for children also. And if you scroll down this page further down, this is where you can find the various language options. Anand, if you can scroll down the page, please.
Yeah. So here you can find English, Arabic, Hindi. I'm just opening a Hindi patient consent form.
Okay.
So Can you see the Hindi patient consent form?
Yes, yes, we all can see the Hindi patient consent form. So I just want to say, at any given point of time, if you ever get stuck with any of the information that I'm trying to give here, we are extremely sorry for the technical glitch that has happened. Please feel free to reach out to the library team. They will direct your query to the BMJ team, or else I will also be sharing my email address towards the end or in the chat box. Just reach out to me, or you can even please feel free to give me a call also. We are there. We are here to help you out. Now we will go back to the main the web page of BMJ case reports, and I will show you how you can submit a case report. Anand?
Yes, Pooja, I have shared. I think somebody else has shared the screen actually.
Dr. Kushwaha, if you could please stop sharing the screen. Yeah, thank you. Dr. Meena, please stop sharing the screen. I would request all the participants to please, put yourself on mute and do not share your screens with us. Yeah. So we are back on the BMJ case reports platform here once again. And now I'll show you where you can go and submit your case reports. So if you just scroll down this page further, you will find the tab which says submit your case report. So when you click on the submit a case report, the first requirement is that you need to have an ORCID ID. And if you do not have one, please create an account by just clicking on create an account. It's going to ask for some information. And once you create your account, then you are ready to browse through then you are ready to start the submission process. And if you have the, Anand, do you have the user ID password for this account here?
Yeah, I'm logging in. So Pooja, I have logged into one of my account.
Okay. Okay, we are still able to see the login account page only. So I'll just talk through once we go to the page.
Pooja, in the time being, there are some questions has been asked, some
Yes.
hands has been raised. So if
Sure,
you can
sure.
take the questions here.
Right. Any questions? You can just put your questions in the chat box, doctors.
Second thing, Pooja, I would like to share that since all the Ermed members institutions is being here, the one thing which is required, while submitting the cases by the doctors is the fellowship code, and that is very important because the institutions will be knowing by the fellowship codes. So the fellowship code for all the Ermed members has been shared to all the Ermed members. So if any difficulty any of the institutions has find to get it their fellowship code, please let us know. We have shared it. We have so whenever the doctor will come to you, and if doctor should know actually that fellowship code while submitting the cases. So once they know this fellowship code, so their submissions will be free of cost. So that is the thing. So you can always be sure that there will be no charges for submission while we have the access of the BMJ case reports. Yeah.
Shikhar, may I request you to please share, if you could share your screen?
For the presentation?
Okay. No, it's okay. It's fine. It's working now. Unfortunately, we are facing a lot of technical issues, and I can see. All right, so we'll just quickly move on to how you can submit your case report. So once you click on Start Submission, you need to click on this tab which says Begin Submission. Click on Begin Submission, and then from here you will be taken to a page. Yes, click on the Continue tab here. Then you would be taken to a page where there would be 6 steps that as an author you would have to provide all the information for. For example, you would have to choose the template that you have chosen for. Whether are you going to be submitting a full case template? So for example, my colleague here has taken full case template as one of the example. And on the left side of the page, as all of you can see, there are 6 steps. Step 1 is type, title, and summary. So step 1, you are required to provide the information with regard to the title of the case report. Secondly, then similarly, just provide the information that has been requested in each of these steps. Step 2 is where you need to upload your patient consent form or any images or videos which is supporting your case report. So we'll just go on to the next step. And as and when you do that, provide the information, just click on save and continue, and then further you move on to the next step. Step 3 is about attributes. So attributes is about choosing the right keywords, because we would like as many doctors to be able to find your case report, because BMJ case report is accessed by 140 countries. You will, as I said, the reach for this particular platform is huge. So that's why please choose the right keywords so that more and more doctors are able to get the information they are looking for. Step 4 is about in the step 4 you have to mention the fellowship code, and I would request, so this is where you need to mention the fellowship code. And for each of the institute, I know that right now we have a lot of institute who have joined, so there are so many institute under Ermed consortium. Now the information with regard to the fellowship code for each of these institute is available with your library. For like in any case, if you are not able to find this information, the other way option is that you can always reach out to the BMJ team. My colleagues would be mentioning the email address and the contact number through, you can just give us a call right away and you would have the information on the fellowship code also. But the first point of contact would be your institution's library. So similarly, I would request all the authors to just furnish the information that is requested for in each of the steps. And once you do that, step 6 is where you have to review the whole case report. And then in case if you see any highlighted text in red color, basically it would mean that that is a indication for you to go back to that particular step and furnish that missing information. So that is the information on how you can submit a case report. I believe I have provided all the necessary information. Once again, my extreme apologies. I wish it was a very smoother, the way I could have given the information would have been much smoother, but due to the technical issues, I was unable to do that. Nevertheless, we will still be in touch with you. We will still be in touch with you through emails, and we will also be in touch with you through other webinar sessions to give you that missing information. This session is also being recorded, so we can also share the recorded link with your library team on this website. So I would be happy to take any questions before we move on to the next session. Any questions from our audience? Please put in you can unmute yourself and ask the questions right away, or you can put your questions in the chat box.
Yeah, Pooja, to add on to your things, since we are not given any information on the submission process, everything is marked as red. You can see that in the screen. So once when you are also submitting the case reports, if you have left out any of the information, it will be coming highlighted as the incomplete portion, so that you can also review and finally submit your manuscript. Over to you, Pooja.
Okay, so now we will move on to our next resource, and that is BMJ journals. So Anand, may I please request you to go to the journals webpage?
Sure.
Pooja, Dr. Supreet has raised his hand. If you can check and
yeah, sure. Who will publish the case report?
Yeah, if you can answer.
Yeah, so the BMJ would be publishing a case report. I'm not sure can you just elaborate on the question?
Sir, I will just answer to his question. Actually, the users of the Ermed institutions, they can submit the case reports with the BMJ, and after doing the peer review process, after completion of the peer review process, if the case reports gets accepted, it will be published in the BMJ case reports journal. Yeah, it can be resident doctors or students or professors, HODs, anyone who are eligible for submission of case reports, they can publish the case reports.
There is one more query about the ICMR institutions. Yes, ICMR institutions who are in the Ermed member, they can have a separate fellowship course which has already been shared. They can submit the cases. Yes, definitely.
So if there are no further questions, we'd like to move on to the next resource. How much in a year? Okay, so let me answer this for everyone. Basically, we talked about a fellowship code. So basically, when you use this fellowship code, then the APC charges are waived off. So that is why it is important that you need to mention the fellowship code. It is absolutely the charges are waived off, and you can publish as many cases as you want in a year.
So for an individual doctor, there is no limitation. As many cases you can submit.
Yes.
Yeah.
All right, Anand, may I please? Okay, we are on the BMJ journals page.
Yeah, can you see the journals homepage?
Yes, I can see the journals homepage.
Sure.
So the journey for BMJ actually begins with our first flagship journal, which is the BMJ. And since then, we have published millions of articles. And most of you are already aware of this resource, as you have had access to this resource already. On this platform, you would have access to journals from others, all the specialities, and you can, on the page, as you can see, you can browse by journal specialty. So as per your specialty, just click on that given specialty on the page here, and you can browse through the article. Now, I'm going to explain you on how you can actually do a quick search when you are looking for a certain article. So for that, all you need to do is go to the extreme right side of the page, which is advanced search. Click on advanced search. And when you click on advanced search, this page would give you, there are 3 to 4 options on how you can find your articles quickly. So I'll just wait till we are able to see the page here.
Pooja, can you see that page?
No, Anand, it's taking time, it seems.
I'll stop sharing and share once again.
In the time being,
yeah.
In the time being, there is, I think, Pooja, it's also important to share that all the access has been activated in the IP, and we have also shared the user ID and passwords for their remote access for their, the doctors for the access during the at their home for their ease. So they can, the user ID and password has already been shared, so they can also access with this. So both the things is activated, and doctors can do their search with with the website, Ermed website, and here that can also go and search the journals, all the journals. Yeah. Yeah, what do you?
All right, so we are on the page where you can now see how you can browse through articles. The first tab is where you can just type in the keywords. For example, if I write treatment of cardiomyopathy on the first tab here, and if I choose a specific period, for example, from let's say year 2015 to year 2022, it will show up, and you can also mention the journals also. So if you click on the all journals, you will find the journals listed here. You can choose the journal, and accordingly the article that you're looking for would show up. The other way is that if you scroll down the page further, Anand, if you're looking for article from a specific author, you can also do just mention the name of the author, the surname first, and then you can also find articles written by that specific author. Anand, have you moved the page down?
Yes, Pooja, I have moved this page down and I have. Can you see the author? I have also typed the name as Biswas.
No, not yet. So, so basically, just to give the information in a nutshell, this is one page where you will find various options through which you can just key in the information, and accordingly you will be able to find the article that you are looking for. There's not just one, but 3 to 4 options through which you can look for the research article. I'd like you take, Anand, can we just go back to the home page, please? BMJ Journals. BMJ Journals is the only journals where you would have access to issue 1, volume 1 of any journal. And where you can find that information is where, I mean, I'll just show you where you can find that information. So let's just go to the hard journal.
Pooja, I have shared the screen.
Okay.
So
Yes, we'll just go to the journal's homepage.
yeah, so they can go via this. I'm using this search. And,
so yeah, Ashika, maybe you can continue. Just give out the information then.
yeah, so the one of the way to go by the Ermed website is ermed.in, and the doctors can go to the journals. So if any doctor wants to go via this, so this clearly goes to the website link. So the ard.bmj.com. The few things that I would like to highlight, I think the search part is you doctors you already know and this thing. But one thing that doctors can have a full archival access with any of the journal of BMJ. So if you can see that doctors can able to see since 1930 the archival access, and the latest the content is available under this section via the latest content. So all the journals which are being within BMJ, they can access via this, and they can access download their PDF for the journal articles whatever listed. So this is the way to access journals. And if you see that again, doctors can do here. The list is also available. All the journals list is available by the publisher wise as well as the journal wise, and then in terms of the alphabetical order as well. If you can see, so that's the way overall you can see in the journals. You can check the you can check any of the year articles previously archival access with BMJ and any other journal with via the Ermed website, whatever the access is being available with you with the Ermed member institutions. I'm happy to take questions. We have covered BMJ journals, the access activated on IP and the user ID and password, and then the BMJ case report. So both the things are available. I would be happy to take the questions. If any questions right now anyone has, so happy to take your questions here. I think someone has raised a hand regarding that. I can see that Dr. Smita. Yeah. Dr. Dr. Sukhpreet fellowship code is only for just a second. I'm answering your question. Yeah, I think Anand has can we publish case reports and research article without paying? Yeah, see, so for BMJ case reports you can publish via the fellowship code. Yes, Dr. Sukhpreet, you're right. Any other question?
Shikhar, in Dr. Sukhpreet Kaur's question, she has asked, doctor has asked about research articles also. So for research articles, they have to go to the respective journals and do the submissions.
Yeah, that is a, yeah.
Yeah, so some
Yes,
channels
yes,
won't have
Garima.
audio processing fees. Some of them will be charging audio processing fees. For OPAX,
Ye-
there will be audio processing fees.
yes, Garima. Dr. Garima, you have raised your hand. Please feel free to ask question.
Ma'am, you can unmute yourself. You're on mute right now.
Thank you, Professor Poonam, for saying thank you. Dr. Akhil, the fellowship has, or may I know your institute now, because we have already shared the fellowship codes. Uh, Akhil, Akhil has asked an query about the code. Akhil, may I know that, Dr. Akhil, may I know that which institute you belongs to? In Ermed list concerned department. Okay. Dr. Anil, what I am not able to understand the question. In Ermed list, the concerned department list not shown.
Shikhar, he is mentioning that in the Ermed page, the journals are not listed as per the department wise. It's not sorted as per the department. It is
So
listed publisher wise actually.
yeah, so there are two ways.
Yes.
Yeah, there are few more hands has been raised. Please feel free to ask question. Garima, Dr. Smita.
Yeah, I'm from MGIMS.
Yes.
It would be really nice if you could give subject-wise journals also, because the users would, as they are in different departments, they would love to access and see those journals. It's right now they have to scroll down all the journals to reach their own departments. So that
Okay.
would be a welcome change.
Thank you for your feedback, ma'am.
Yeah, it's also available, Shikhar. I can share you the list and you can share it with the concern.
There is one question from Dr. Prabha. What is the fellowship code of BHMRC ICMR? Ma'am, we have shared once again. Pooja, if you can note down, just share the code for BHMRC ICMR Institute.
Yes.
Okay. There's one more question which is saying why IMS BHU, why are not the open full text some genders? If you can share the screenshot, because all the access is available on IP as well as the user ID password. Please share the screenshot, especially mentioned to IMS BHU. They have asked the question. We will if there is a problem, we will definitely reply to you. Please share the screenshot, sir, whenever you have time. Yeah, by today. Any other question?
Dr. Prabha Agni Bose has asked a fellowship code for BMHRC ICMR.
Yeah, we will share.
That will
We
be
will
shared
share.
with, yeah.
We will share once again. Yeah. Thank you, Dr. Sikpreet Kaur.
I'd like to add one more thing, that this is the first session that we have done, and we plan to do more such sessions. In fact, we may also do special sessions for your institute as well. Just let your library team know that you would like to have a special session conducted by BMJ, and we are here to do that. All you need to do is just reach out to us, and we'll be able to do a very detailed session about case report. Going forward, we will also plan to do a session with our chief editor of BMJ case report, wherein she will provide you information on the do's and don'ts of what are the things as an author you need to keep in mind while you are trying to write submit a case report, and what is it that BMJ is actually looking for. So just keep a tab on the emails that you keep getting from your library team, because we reach out to the library team of each of the institute under Ermed Consortium. Sure, we'll share the fellowship code for both the institute that are listed here, BMHRC, Bhopal and ICMR Institute. In the meantime, as I said, for information with regard to fellowship code and the user ID and password, please reach out to your library team. They are already informed about it. At the same time, we will again push forward the information once again. Thank you. So if there are no further questions, Shikhar, okay, there is one question. So can we publish the dental case reports?
Yes, very well. There is a separate section for dental case reports also.
So if you go to the casereports.bmj.com page here, you will find a section dentistry and oral medicine. And under that, you'll see the various types of cases that are published. What about nursing? Yes, we do also publish cases with regard to nursing also.
And one more information, doctors, BMJ case reports is indexed in nursing database called CINAHL also. So it is indexed in Scopus, PubMed, Medline, as well as CINAHL. So CINAHL is mainly for nursing. Yeah, all specialties of nursing, midwifery, yeah, everything related with nursing will be covered.
Dr. Iqbal has raised his hand. Dr. Iqbal, please go ahead. You can ask the question. Okay.
I've mentioned
my email address. It's pnair@bmj.com, and I've also mentioned my contact number. At any given point of time, as I said, please write an email to us or please give us a call and we can take your questions. And if there are no further questions, I'd not like to hold all of you, as we understand that as doctors, you're very busy. With that, we'd like to,
Pooja, there's one question has come up. Dr. Kamlavati has raised his hand. Yeah, please go ahead. Yeah, please go ahead, ma'am. Unmute yourself and. Yeah, Director RT has raised a hand. Please go ahead with your question.
I think it was by mistake, maybe.
If any challenge, if you find any challenge in asking any issue, that you can